So, as Jennifer introduced us, Blake Lanier and I will be sharing this presentation, and Abby at the beginning of her presentation gave a little bit of preview that gets us in the right mindset for the Older American Act. So, I think let's get started. Let's see. So what we are going to go over this afternoon is what happened at the creation of the Older American Act. What was the purpose of it? What was the goal? I'm a bit of a history buff, so I get into a little bit about what was going on at the time. Then, as Abby said, we're talking about the Older Americans Act of 1965, but it is not the same act that passed originally. So what are the changes that have occurred over time to the act itself, to what we have to do in Georgia? We will get into more of the details with the parameters of the act. What does it set out for? Who does what when it comes to policy? We will get into the requirements and obligations that the Act puts on the state unit as well as on the area agencies on aging. And we will do a quick breakdown of the regulations under Title III, which would be the most of what we do, and Blake will get a little more detail in that and go beyond that a little later this afternoon, and then we will provide some resources that we will be able to send to you where you can go and find out more information yourself. So I think we'll get started, and I love talking about the history part of this. So the passage of the Older Americans Act of 1965. Abby gave you the year and the president earlier, and we're going to talk about what happened with the reform for seniors that happened that year. So whenever we talk about legislation passing, even back then, things did not pass quickly. So we've got to look back several decades when you look at what had been happening and forming in the country and informing what the legislature and the president would do. So 1965, let's think a little bit more about that date. So obviously, we are in the time of the Civil Rights Movement, which is continuing today, but yeah, and this is not on the slides, Blake. So, so we're talking. We're in the Civil Rights Movement. Also, think about where the country is when it comes to wars. So we had World War II end in 1945. We had the Korean War in the early 50s. We had the Vietnam War in the 60s. So you're talking about 3 decades of mothers sending their sons off. We were in the draft or volunteer, but a lot of sons going off to war. So that had been going on every decade for most people's lives at that point in time, which weighed heavily on this as well. You had sort of a change in society when it comes to transportation and being more accessible. And you think of, 40, 50 years before this, people didn't often move out of their hometown or would live on the same farm or the same land where their parents had lived or grown up. But you had more people when they returned from war, if they did, moving into the cities. You had more people where all of the children were moving out of the family farm or the family land, which was a changing dynamics for society. You had the baby boomers coming about. This, we're talking about 1965 here. At this point, we say that the boomer age was from about 1946 until about 65, but they didn't know that at that time. So you'd had this generation of a whole lot of children born, which for government also means that people heading into the workforce or at some reasonable point in time heading into that workforce. And then you talk about medical advances and people living longer. So you've got all of this surrounding yes, Blake.
No, I didn't. I just moved my mouse, but still, yeah, it was a tumultuous time, and we were about to begin another war, uh, and send not just our sons, but our daughters for the first time into combat zones. And this it was a period of turmoil um, throughout the country. So yes, absolutely.
So in 1965, there were several acts of legislation passed that did look at what is going to happen to our seniors once they are out of the workforce again, so that they have worked and they're retiring. And in 1965, President Johnson signed into law the Medicare Act. So we're talking about medical insurance, again, for those persons living longer and who are retiring, and the Older Americans Act. There was another act that was passed that was the predecessor to what we call Medicaid. That was not formally, we didn't have Medicaid in 1965, but there were these multiple acts that were not necessarily connected, but we're all looking at securing basic stability, services, and health care for senior citizens, for retired persons. Again, the original Medicare Act that was passed did provide from its beginning, Part A for the hospital insurance and Part B for medical insurance. And then this Older Americans Act, which I think was very revolutionary, but established as a primary vehicle for organizing and delivering community-based social services programs for those age 60 and older, and that it set the framework for doing this at the state and local level, which is also very unique.
Yeah, way ahead of its time. You see similar acts passed in the late 70s through the 90s, but the Older Americans Act was among the first that tried to set up a community framework for delivery of service and to leverage federal dollars with state and local dollars. So it was revolutionary, and it set a model that's been followed for many other programs at this point.
So here's the detail part. If you want to go look up the law itself as passed, we talk about public law, and we've got the numbers here to look it up. And the way that lawyers would look at the USC is United States Code. So 42 United States Code 3001 and continuing from there. And what it did was establish this coordinated system of services, which is a flexible framework to be catered to the local needs. So that when we talk about, if you see one state unit on aging, you've seen one. If you've seen one area agency on aging, you've seen one. Because the framework of this law does have standards, but it allows for flexibility. It creates this federal and state to local partnership for administering the act. One of the basic requirements in order to be a part of the act is that the state itself must designate a state unit on aging, or a state level entity which is responsible for the coordination of the funds used under this act, and then is also responsible for monitoring those funds and those services. And even from early on, it is elder focused. It does have the requirement of the age, but it also, from very early on, was focused on looking at disabled adults and caregivers as a part of the service provision. Something working from home. I've got my doorbell ringing. Okay. Let's see. So let's get into how the act has changed over time. So as I mentioned earlier, yes, when we talk about this act, as you do with many laws, you say the first year that it passed. But clearly we are not living in 1965. The act, as in all laws, must be renewed or reauthorized regularly. So this again is called either a reauthorization. It can be amended at that time or at any time. For many, many decades, the reauthorization was coming about every 5 years until 2006. And then we got way off cycle. After 2006, all of the state units on aging were waiting and waiting. And technically, the law was not reauthorized, but it continued to be funded through omnibus funding and budget bills. So this put the Older Americans Act programs, because it wasn't technically reauthorized, but it was being funded. And this is about when I started here at the division, is when you all may recall that the omnibus spending bills were hit by the sequester. When the government went through, well, if we are going to cut everything, that was the Older Americans Act programs were in limbo there and were hit by the sequester for several years. I know Blake had a lot of great fun as we were looking through the sequester changing the Older Americans Act.
Yeah, depending on the program, we lost between 3 and 6 years worth of funding, funding increases. It was a huge cut, and particularly hit supportive services and meals hard. Now, to frame that a little, Georgia is what's called a growth state. Our aging population is growing very rapidly. It's the largest growing demographic in the state. And as such, we were drawing more dollars because the Older Americans Act funds are distributed based on a series of demographic factors and an interstate funding formula that ACL uses. So it hit us particularly hard. And just within the last 18 to 20 months, we have come back to the level that we were prior to the sequester.
Yes, so we have had 2 authorizations in the time that I have been working with the Department of Human Services. In 2016, there was the Older Americans Act reauthorization signed by President Obama. And then just about a year ago, we just passed this, in 2020, when not much else was going on, Congress did pass the Supporting the Older Americans Act, which was signed by President Trump. So each of these reauthorizations have made changes to the law itself, to the United States Code. We have been waiting for a long time to see new changes and updates to the Code of Federal Regulations, which would also come out of DC and follow the changes in the Act. There have not been updates in, I want to say 3 decades to the Code of Federal Regulations. So we're waiting for that. Some of the highlights that I like looking through, again, to give context of where these programs come from and where the focus is. In 1965, the basic framework of the Act was created. In 1969, they came out with the first 9 national model demonstration projects for Older Americans Act services. The meals program, the first meals programs were established in 1972. In 1974, transportation was added. I know all of you in the AAAs know how important, even to this day, transportation is for our seniors that we serve. In 1978, there was mandated the Long-Term Care Ombudsman Program to serve as a visible advocate for the elderly, those living in long-term care facilities. In 1981, the Act emphasized supportive services to help older persons remain independent in the community. And when I see this date, what comes to mind for me, as you know, the Older American Act programs are serving seniors, and the vast majority of those seniors then would have a variety of disabilities that come with age. But the Americans with Disabilities Act was not signed until 1989. So you can see that this act, the Older Americans Act, emphasizing services to keep people in the community, what was definitely a precursor to the Americans with Disabilities Act, and that this came around, there wasn't the basic federal framework for access to services, access to buildings, ramps, parking spots for the disabled, that this was in place and that the services were going in that direction for not quite a decade, but a good number of years before the ADA was signed into law. In 1992, they added the Vulnerable Elder Rights Activities section to the Act, and in 2000, they created the National Family Caregiver Support Program. So these are a lot of the highlights along the years as the Act has changed and grown for our community. So the basic parts of the Older American Act are divided by title. And so you'll hear a lot of references with the AAAs to Title III or the different sections within that. But to go over the basic parts, we've got Title I, the Declaration of Objectives and Definitions. Title II, which creates the Administration on Aging, mainly talking about what's going on in DC, where the federal administration of the Act and the formulation of the federal functioning. Title III are the grants for state and community partners. So that's where you get into the state and the local regulations and programs. Title IV, discussing activities for health, independence, and longevity. Title V, Community Service Senior Opportunities Act. Title VI, Grants for Native Americans, and Title VII, Allotments for Vulnerable Elder Rights Protection Activities.
Yeah, and Julia, most of what we would focus on with the AAAs is in Title III, which includes the supportive services, meals, family caregiver support, and so the core AAA programs are all located there. But it is a much broader scope to the Act than just Title III. And we tend to focus on Titles III and VII because VII includes the funding for the Ombudsman program, the majority of dedicated funding for the Ombudsman program. So it's a broad act, lots of services and lots of different foci to the parts of the Act.
Yes. So as we mentioned, Title II is about the establishment of the Administration on Aging. You don't hear AOA so much anymore. That's because, again, as things change and move, that the Administration on Aging was moved within a larger entity of HHS, which was created in 2012, the Administration for Community Living. So ACL and subsequently AOA are within the U.S. Department of Health and Human Services. And when ACL was created, it brought together the functioning of programs under HHS for those with disabilities. I'm missing. And a couple other agencies which also, again, are focusing on persons with disabilities and older adults so that they should be able to live where they choose, with the people they choose, and fully participate in their communities. Those other agencies, for the most part, didn't exist at the time that the Administration on Aging was created, but were later developed. And clearly, as you can see, we have the same fundamental principles. And we do share the Administration on Community Living's mission statement and vision. And you see how similar they are to our own that we went over earlier, with the mission statement to maximize the independence, well-being, and health of older adults, people with disabilities across the lifespan, and their families and caregivers, with the vision of all people, regardless of age and disability, to live with dignity, make their own choices, and participate fully in society. Then I think we start into our fast breakdown of the titles and the different obligations under each one. As Blake said, the Title III is the bulk of what most of the public sees as the Older Americans Act. Older American Act grants, they're called grants, are awarded to state units on aging, who in turn allocate them to area agencies on aging. Funding is complex and is based upon partially upon population. It is for the purpose of planning, developing, and coordinating systems of supportive in-home community and based services. The SUA, the State Unit on Aging, and the AAAs themselves are restricted in the Act from providing direct Older American Act services, except by special permission. That is something that is unique amongst federal programs as well. This was created to be this framework of funneling the funds down to the local and having them work directly with providers to provide the services.
Yeah, and Julia mentioned that the funding is complex. The Act mandates that state units use a federally approved intrastate funding formula that's based on population for a number of demographic groups. And so we must do that and must use the formula to allocate the funds to the planning and service areas, for which there's one AAA to serve each. So it is fairly complicated, but it's meant to assure that there's equity in funding and equity in access to services across the state.
Yes. So what is required of the State Unit on Aging under the federal law? So the right here, we explain some of the basic parameters. It's a very long act, so I do invite you to go read, but we wanted to point out some of the basic requirements of what does it take to be a state unit on aging. Within this section, it does say, as you mentioned first, that the state shall designate a state agency as the sole agency. That's something that that Georgia designated to the Department of Human Services, who then created the Division of Aging Services. The basic responsibilities fall into these main categories: to develop a state plan. So that's exactly what you heard from Miss Elaine Popham earlier in talking about the state plan. And then to administer the state plan. So a lot of what she was also saying talked about how do we administer that state plan and how do we ensure that we are keeping up with the requirements of that state plan. The state agency is also primarily responsible for the planning, policy development, administration, coordination, priority setting, and evaluation of all state activities related to the objectives of this act. So at the state unit, Abby and her staff are doing all of these things on behalf of the state agency. The state agency is required to serve as an effective and visible advocate for older adults by reviewing and commenting on all state plans, budgets, and policies, again, that are related to the objectives of this act. And one of the other requirements on the state agency is to divide the state into distinct planning and service areas. So you will hear the Division of Aging Services refer to the PSAs. The PSAs in Georgia are then, well, every PSA has a AAA assigned to it. So here is the state law that I just mentioned. When the state of Georgia designated a state agency on aging, here it is at OCGA, which is Original Code of Georgia Annotated 49-6-2, that designates DHS as that state agency required under the law. Then, as we mentioned, Title III is the part of the act where, again, most of the public know about our services and what the AAAs do. So breaking that down, you will usually hear Title IIIB or Title IIIC, which would be the most popular, or again, where most of our services fall. Blake, do you want to talk about these a little more?
Yes, Julia, thank you. Supportive services is a broad range of services that may seem, well, some of them are quite personal in that they help someone bathe, help someone keep their house, help them with activities of daily living that they can't quite accomplish anymore, but it allows them to stay in their homes as they wish. It keeps them out of an institution. It's also much, and this is secondary because this is client focused, but it's also much less expensive than having someone placed into a facility. And I'm not going to repeat all of the services, but it's designed to fill those gaps that a client may have that would prevent them from being able to stay at home. And you'll hear when the program folks start talking about assessments, you'll hear about activities of daily living and those things that a client may or may not be able to do, and then matching those up with services. And most of those supportive services are contained in are funded from Title IIIB. And now we're very fortunate in Georgia that the Older Americans Act is not the only source of funding that we have. We've had tremendous support from several administrations and from the General Assembly. Also have state funds. We have social services block grant funds that all supplement and coordinate to provide services. And I might add at this point too that the Older Americans Act does require a match, and there's several other requirements. But the General Assembly and the governor over the years have been very, very supportive and have funded us above that level. And again, Georgia has a very fast growing over 60 population. Then Title IIIC nutrition service, it's exactly what it sounds like. Congregate meals are meals that are served in a senior center and are coupled with a social component, maybe a wellness component. A home delivered meal may have someone that cannot physically get to a senior center, and the meal is delivered at home to fill that gap if they can't cook for themselves. And then, of course, nutrition education, because part of being able to stay at home is being able to maintain health, and nutrition is a huge component of that. I'll go ahead with this next one, Julia. Title IIID, we call it Frail Elderly Services. It's similar to 3B services, except for those services that are funded with 3D are required to have an evidence basis. In other words, they've gone through a trial with a university or a hospital system or someone, so that they're proven to prolong a person's ability to stay in their homes and to improve their quality of life. 3E, Family Caregiver Support Services, it funds a lot of the same services as 3B and C, except that there must be a caregiver in place to support that person. And many times you'll see a 60 or 65-year-old caregiver supporting an 80, 85, 90-year-old client. So both need support. And the caregiver could be respite, could be adult daycare, could be many of those services that allow the caregiver to do things or to have personal time away from their constant duties of caring for the other individual. And Title III-F, which is something that's out there, it's in the Act. We don't talk a lot about it, Disease Prevention and Health Promotion Services. But it is specific to chronic disease, self-management, and diabetes at this point. Julie, you want to swap back? Or you want me to continue?
Sure, I can talk. I think that Title IV it is more about special projects and grants. So some of the programs which have worked their way into other titles start with special grants and projects. This is something that is also, from what I've seen, unique amongst federal programs, and that there are constantly new grants and options coming out. Most of them seem to bolster and work with the other programs that we have. But as we talked about each of the AAAs and each of the state units on aging being different, this is part of the reason why, and that there are grants and unique opportunities offered that will go to one or two states or a handful of states at a time. And they're not always on the federal fiscal year, the state fiscal year cycle, which also makes them unique and confusing.
Yeah, ADRC is a good example of a program that's originally started as demonstration grants under Title IV, as was CSEP, which was long time ago, decades ago. But those were begun as demonstration grants and then mainstreamed into the Act upon reauthorization.
Blake, can you explain what CSEP is?
We're going to get to that with the next slide.
Great.
We certainly are. So yes, CSEP is the Senior Community Service Employment Project. And it is very, very unique in that it's for those that are age 55 and older, which is different than the other Older Americans Act programs. And it partners with the U.S. Department of Labor, who actually runs the grant, to retrain or train seniors to continue employment and to be able to self-support. And there are two sets of providers. Each state gets a grant that either goes to the Department of Labor or to the State Unit on Aging. And those state grants fund part of the state. There are also nationally approved providers, such as United Way and some of the others, who handle part of the state. And the Department of Labor parses out the state to each of those organizations to accomplish the program. But it definitely, the requirement is that 75% of the funds must be to enrollee wages, and administration and other are limited Um, so the thrust really is to retrain and to get seniors reemployed.
Yes, I think this very much stemmed from, and as Blake talked about, demonstration project, age discrimination in employment. Research looked at that it was happening at ages younger than 60. So when the program came about, they were going from research that chose then age 55. And really working on training individuals who are either have not been in the labor market or have not been in the labor market for a while, to give them those skills to get the job, to continue working, because you can obviously keep working for years after age 55. So again, that's one of those unique programs, and it is very complex in nature because the federal regulations exist both under Department of Labor and under the Older Americans Act. Let's see. Now Title VI here, one thing, and I'm not sure if we mentioned this time, but there are actually 56 state units on aging. And you say, okay, we don't have 56 states, so why is that? Well, there are specific, there was not a better title, so state units on aging, designations for tribal organizations and entities as well. So Title VI goes through different grants for Native Americans, Native Alaskans, and Native Hawaiians. And again, there are they have their own state unit on aging structure for multiple tribal organizations, and they sort of coordinate the services for their tribal peoples as a state unit on aging.
And then, of course, there are state units on aging for the territories, even though they're not funded from Title VI. So yeah, like Julia said, there are 56 state units on aging. The District of Columbia also has a state unit on aging.
Yes. So Title VII is the Vulnerable Elder Rights Protection Activity. So this includes the establishment and authority for the Long-Term Care Ombudsman Program. As we discussed, some of the funding is designated from Title II. But the establishment and authority is under this. Also, programs for prevention of elder abuse, neglect, and exploitation, which includes public education about elder abuse and outreach and training. In the state of Georgia, a good portion of that funding is used for what you all know as the Forensic Special Initiatives Unit, which has done great work in doing outreach to law enforcement and courts and coroners, and is just really circulating the state, doing training about elder abuse. And if you have not attended an ACT training yet, and now that they have perfected the ACT virtual trainings, we do definitely invite you to look into enrolling in an ACT course, because it really is something. Now, this second dot here to go back to, so the Act itself does not establish adult protective services. It did add the definition adult protective services in the 2016 authorization. It does discuss the AAAs and state units coordinating with your state adult protective services. Just now, for the first time ever, starting with some of the pandemic funding, the federal government is sending some adult protective services funding to the states for elder abuse investigation. So that is something brand new that is starting, and we hope to see it become more established and actually become an annual part of the Act, because it's interesting to see the state or the federal regulation mention something and then not fund it, leave it entirely up to the states to fund. So perhaps this is something to keep an eye on as it changes over time. And also within Title VII is the State Legal Assistance Program, or the Elder Legal Assistance Program, ELAP, which provides no cost or low cost legal assistance for seniors, also to protect themselves from abuse, neglect, and exploitation. So all of those are a part of Title VII. So the next thing that we get into, it gets more into the nitty gritty. As we go through, we talked about generally what each of those titles sets up, but we wanted to get into more detail here about the requirements and obligations. So it does set up a general framework, but trust me, there are obligations that are required of either the state agency and the area agencies under the federal law. So to make you all aware of, within the framework we discussed, what is required. So the state agency, and so I know we've got, I think, a lot of details here to cover, so we'll try to go quickly. The state agency must provide assurances that they will take into account, in connection with the development and administration of the state plan, the views of recipients of supportive services or nutrition services or individuals using multipurpose senior centers. This is part of the requirement when we are creating the state plan, as well as other times. The state agency must have public forums and listening sessions, and must include seniors and those who receive the services when deciding how to administer the state plan and the services. So for those of you who've been around for 2 years, you have seen the last round of big public forums and listening sessions when we were working on creating the state plan. Another requirement is that the state agency must, in consultation with area agencies and in accordance with guidelines issued by the Assistant Secretary and using best available data, develop and publish for review and comment a formula for distribution within the states of funds received and intrastate funding formula that takes into account both the geographical distribution of older adults in the state and the distribution among the planning and service areas of older adults with the greatest economic need and older adults with the greatest social need. So when creating the intrastate funding formula, as was mentioned earlier, it's not just about geography. There are requirements and specific definitions of individuals within the population that must be focused upon. So, and here's where they get into details about those requirements. The state agency must provide assurances that preferences will be given to providing services to older adults with the greatest economic need and with the greatest social need, with particular attention to low-income older individuals, including low-income minority individuals. Older individuals with limited English proficiency is a specific requirement, and older individuals residing in rural areas. So you look at basic geography and you might have concentration of individuals within cities, but another requirement in looking at how the services are provided and the funds expended require looking at older individuals in rural areas. So that's something that the state must balance there.
Yeah, I might note at this point, if you really want to take a deep dive into the intrastate funding formula, the entire formula is published in the state plan. And so if you want to see the exact weights and distribution and data sources and which of those factors are used in our formula, that's where you would go to see it.
Yes. And we do recommend becoming familiar with the intrastate funding formula. Another requirement in this section for the state agency is to promote the development and implementation of a state system of long-term care that enables older individuals to receive long-term care in home and community-based settings in a manner responsive to the needs and preferences of older individuals and their caregivers. That again gets back to the focus and the mission of what the agency does, that this is not focused on nursing home care, that we are focused on helping an individual to live healthy and live well in their communities and their preferred way of living. The single state agency must implement evidence-based programs to assist older individuals and their family caregivers in learning about behavioral changes intended to reduce the risk of injury, disease, and disability, to provide for the availability and distribution of information related to the need to plan in advance for long-term care, and about the full range of available public and private long-term care programs, options, and services. This relates also to education that's done through the AAAs and their providers. It relates to information and referral, and all the resources that we provide to help people know what is available to help them age in place. And there are other leadership, policy, management, and administrative duties that the state unit must comply with. Then the federal law does get into requirements on the area agencies themselves. Just like the state unit must create a state plan, the area agencies must develop an area plan for development and delivery of a comprehensive and coordinated system for supportive services, nutrition services, and where appropriate, the establishment, maintenance, modernization, and construction of senior centers in the area to be served by the area agency. So again, we're getting down from the federal to the state to the local level of creating this plan for services. And the area agency must provide assurances that an adequate proportion of the funding that they receive will be expended for the delivery of services associated with access, in-home services, and legal assistance as well. The Area Agency on Aging must designate where feasible a focal point for comprehensive service delivery in each community, giving special consideration to multipurpose senior centers, must set objectives consistent with state policy for providing services, again, to focus on older individuals with greatest economic need, with greatest social need, and at risk for institutional placement. Must, in their state plan and their services, include objectives for providing services to those targeted communities, also including those in rural areas, and must make other assurances that programming includes specific components designed to reach and serve those targeted demographic groups. So again, even though Older American Act services are not need-based services, there's not an economic requirement. The Act is very clear about focusing on those in the greatest need. The area agency must serve as the advocate and focal point for older individuals in the community, even if they're not receiving services through them. Must, where possible, enter into arrangement with local communities, including those organizations providing daycare services for children, those who provide caregiver services, respite services, and other opportunities. The Act goes into a lot of detail about creating these intergenerational services. So even though we are serving those who qualify as being 60 and older, they do want to create that community and network. They must enter into arrangements and coordinations with organizations that have a proven record for providing services to older individuals. And the Act itself does detail the use of trained volunteers in providing services and direct services to older individuals and individuals with disabilities, which again is unique amongst the Act, but you are using sometimes those who would qualify for services themselves as trained volunteers in providing services to others in need. Every area agency on aging must have an advisory council. The advisory council consists of older adults who are participants in services or who would be eligible to participate in those services, as well as the council consisting of family caregivers, representatives of older individuals, service providers, the business community, local officials, veterans officials, and the general public. So using their advisory community to keep that finger on the pulse of what's going on and to direct the development of their area plan to keep the services relevant. And there are other provisions, again, on the area agency on aging within the federal requirement itself. And we are getting close to the end. Just one other provisions within the Act, again, that gets complex, but it talks about that each renewal will set, and Blake, maybe you can describe this better, but we'll set an appropriation amount or sort of a floor for an appropriation amount within each renewal.
Yes, each renewal will generally specify the total amounts of funding by part for the next number of years, and it will specify by year or by percentage increase. So it will say total nutrition services will be $126 billion for FY19, $128 billion for FY20, and so on. Or it will say nutrition services budgets will be 126 million in FY19 and will increase 5% per year through the duration of this renewal. They've done it both ways. And then it provides, of course, the method by which funds are distributed to the states, territories, and tribes. And it's not as simple as saying, okay, we get a 50th, because they set up an interstate funding formula that takes into account many of the same demographic factors that we must consider in the intrastate funding formula, but it also sets a floor for states and territories and tribes so that there's a minimum level of funding, and also sets a hold harmless for those states that are losing population so that they will not drop more than a certain amount per year. So it gets a little complicated, which means that high growth states like Georgia do not get the full benefit of the formula funding. It takes a while for it to get there. So what happens is you're padding states that are losing population, really, and I'll use the term by penalizing states that are growing quickly. Now, penalizing may be a bad word, but since we're a high growth state, it feels like it sometimes.
And I think this slide, we include a couple of other things just to mention, and if you need more detail, you can ask Blake or myself. It sets mandates for maintenance of effort requirements for state plan services and long-term care ombudsmen. There are also provisions in the Act that talk about cost sharing and voluntary contributions and how each of those can be handled. There is information on provisions for disaster relief payments, although we had a lot. We've been through the biggest disaster in the last year, which went beyond the Act, and there was, of course, funds included in the Families First Coronavirus Act and the CARES Act, and the most recent act as relating to services for seniors. But the traditional act also includes the NSIP, the Nutrition Services Incentive Program, which talks about using funding for local and American created nutrition services. Is there anything else from the Act that you want to bring up at this time, Blake?
No, that's it. That's the basic framework of how the act is set up. Uh, and I think probably in the future, we'll wind up having some smaller pieces. And I know Love is on the call, that we will have to piece this out, because each one of these slides probably has a session by itself to cover details that just roll up into those titles. It's a voluminous act uh, with a lot of detail and a lot of specificity.
It certainly is. So thank you all for listening and letting me participate in presenting to you.